So it is the second largest organ in our body, but is our lifestyle secretly damaging it? We're going to find out because the doctor is in, and today he is going to tell us if we are at risk for liver disease. Dr. Scott Ackerman is one of the First Coast leading oncologists, and he joins us every Friday to talk about important health issues like the liver. How are you?
Excellent, Nick. Good to see you.
We just talked about this morning, and you did, confirm it is on this side.
Yes.
But what exactly does the liver do in our bodies?
The liver is a large organ. It sits right here in our abdomen, just below the rib cage, mainly on the right, but it goes a little bit on the left. And it's a key player in the digestive system of our body. Everything we eat and drink goes into our stomachs, and it gets absorbed in our stomach, and a lot of it gets passed through the liver, and a lot of the toxins go through the liver. The liver filters these toxins and chemicals from our blood. The liver also acts to regulate hormones and blood sugar. It also, a lot of the energy from our food is stored in the liver. The liver can manufacture cholesterol. It can also store cholesterol. It makes certain blood proteins. The liver also makes bile, which we use in digestion. It's about the size of a football, actually.
Wow. That is huge. I didn't even know I had an organ that big in my body.
It's a lot larger than people realize. When I talk to patients about it, and I show them CAT scan images or whatever of their body, and I show them the liver, they can't believe how one organ can be so big in the body.
That's unbelievable. I'm guilty of this, as I'm sure a lot of other people are. We hear, we've heard over the years, Larry Hagman, liver disease caused by alcoholism, and so on and so forth. Is alcoholism the only thing that contributes to that?
Well, alcoholism is a big reason for liver disease, but there's lots of causes of liver disease. And just because someone has hepatitis or cirrhosis doesn't necessarily mean that he or she is an alcoholic, or it wasn't necessarily caused by alcohol. As I said before, the foods we eat and ingest have toxins. They get filtered through the liver. So alcohol and medications and those sort of things all go through the liver. Mm-hmm. So alcohol, as it gets absorbed, it goes through the liver, and it causes, in excess amounts, it does cause damage to the hepatocytes, those cells in the liver, which causes the liver to be functioning less, and a disease we call cirrhosis. Mm-hmm. There's also non-alcoholic cirrhosis, and that not necessarily due to chemicals or anything, but just by the fact you have a lot of sugar, a lot of obese people that have poor insulin control. That obesity leads to fatty infiltration into the liver, which also causes cirrhosis. High cholesterol, these cholesterol plaques go into the liver, and that also causes liver cirrhosis as well. And then medications. They could be vitamins that people take. Excessive amounts of certain vitamins can be a problem. Acetaminophen is a big culprit. Acetaminophen, the drug that's in
you talked
Tylenol,
about this before, right?
And it's in NyQuil and those sort of things. It's a great drug. It's great for fevers. It's great for pain. But in high doses, it can be toxic to the liver. And you can build up high doses of acetaminophen rather quickly without knowing it. If you take a couple Tylenol 4 or 5 times a day, before you know
you're there.
You're there. And then you add on to that
some NyQuil or other.
Exactly.
I don't know if NyQuil has it,
yeah,
but
absolutely.
That's one.
Alka-Seltzer,
and that's one thing too. Is that, are we constantly looking at everything that we're taking? Or are we just like, well, NyQuil helps me sleep, so I'm going to take that, but I'm also taking a Tylenol or whatever.
Right. So regarding these chemicals and medications like acetaminophen that we know does cause liver damage, I encourage my patients all the time to look at the label, see how much you're taking, because you can get to a level that would be toxic on the liver. Right. And the fourth cause of liver disease is hepatitis. We hear a lot about that. A lot of people my age now have something called hepatitis C. So back, we used to be very familiar with hepatitis A and hepatitis B. Hepatitis A we get through bacteria that's in contaminants in water and food and those sort of things. And hepatitis B, Hep B, patients can contract through blood and needles and those sort of things, or blood transfusions. So we've tested for hepatitis in the past through blood transfusions, but only recently were we able to test for hepatitis C. So there's lots of adults today that received blood transfusions as a kid or a young adult that may be positive for hepatitis C. And it's and we see it in huge numbers now, and this is a very serious disease.
So what should we be looking for? What kind of symptoms might we have if we're having difficulty, or if our liver's not doing what it's supposed to be doing?
Well, the early signs of liver disease are like the early signs of a lot of things. Weakness, fatigue, weight loss. We see that all the time with all sorts of diseases. But if you have that chronically, and it builds up with nausea and vomiting, and even jaundice where your skin turns yellow, that's a real sign that you probably have fairly severe liver disease. You should get to a doctor.
What do we do to prevent it? million-dollar question.
Well, alcohol. You want to make sure that you limit your amount of alcohol consumption. 1 drink a day for women, 2 for men, only because men are larger than women typically. Maintain a healthy weight, maintain a good lifestyle, exercise, those sort of things. Look at the medications, read the amounts of acetaminophen, especially that you take. Don't take more than 4 grams a day or 4,000 milligrams. And if you are high risk, if you're going to travel to an area of the world where hepatitis is endemic, or if you're in healthcare, consider getting the hepatitis vaccination.
Let me ask you this. If you're drinking alcohol and you're taking acetaminophen, are these both working against the liver, or are they different sections?
You know, yes, they are. There is synergy between all these things that can be toxic to the liver. There is synergy in those. So yes, you want to be careful, because there is more than an additive effect when there's alcohol and medications like acetaminophen.
Be cautious.
Yep.
Dr. Ackerman, as always, thank you so much. You can we can get everything we need to. If we want to come to your Facebook page or anything like that, we can ask you any questions, and we want to thank them for sponsoring this segment as well. If you have any questions, like I said, regarding the topics or any other health questions you might have, visit Dr. Ackerman's Facebook page at facebook.com/First Coast Oncology.